Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, GL Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of Medfield's Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by following the instructions on the agenda and meeting notice. And so there we go. Obviously, people can use the Q&A function, and when we have appropriate times for public comment, we can address those questions. And if someone would like to speak live, there's always the option to indicate that with the Q&A. You do have to give your full name in order to do that. But then, we can call on you at the appropriate time for public comment. We have a pretty big agenda today, and we have a meeting at 4:30 where I think Dr. Marsden is joining the meeting. And
we're just waiting. Bridget's signing in right now.
Okay.
So give her 1 second.
So yeah, we'll start off with the health agent update.
Yep, I just sent her the link, and then I'm just gonna promote Roberta because Roberta's been working with Bridget and I on the vaccinations for her seniors, so I want to have her participate in that as well.
Oh, okay, great.
So just give Bridget 1 second. I unfortunately sent her the wrong link.
No worries.
Just needed to resend it. I think this is like my 5th Zoom today, so bear with me.
Hi, Roberta.
Hi.
Hi, Roberta. Nice to see you.
Ooh, bad picture of my bulletin board. Oh, well.
We had a member of another board in town send out an email suggesting how all of us could improve our Zoom appearances this week.
Oh,
and
no.
If we followed their rules, some of us could look 20 years younger. So I think I resembled that remark. Okay. Here's
Christine, you didn't share that with us.
No, I did not. So, yeah.
Although you're wearing nice jewelry.
Thank you very much. Well, I'm trying to up my game after I got the email.
That's funny.
Oh, boy.
All right. Bridget's here.
All right. Hi, Bridget.
Hey, how are you?
We're going to kick it off with your health agent update.
Okay. So things have changed even as of today. There are sector-specific protocols that have changed starting Monday, February 8th. Capacity requirements have been increased. Most businesses will return to 40% capacity as previously allowed. So our libraries, our gyms, our health clubs, our churches, indoor golf, movie theater, etc. Restaurants will also go from 25% to 40% seated capacity. Employees don't count. Close contact personal services will also be increased to 40%. And so that's a good thing. We're slowly, coming back to more involvement. The reminder that the gatherings limit still remains at 10 people indoors. So maybe a little public service announcement to be careful during your Super Bowl parties this weekend, that you don't have a party and you stay with your family and celebrate safely. Routine food inspections have been going well. On top of the routine food inspections, also doing a COVID compliance, which operators seem to like because it gives them an additional resource and a checklist for their own internal operations. I'm busy with septic still, which is kind of weird in the middle of winter, but that's fine. And then just a couple handful of COVID compliance complaints and concerns that we continue to investigate and follow up with. Also working closely with the public health nurse in the town of Needham to help facilitate additional vaccines for our over 75 population, as well as our local housing, our housing authority residents. So that's been going well. Tiffany's been a great resource and is working with us, and I actually have a meeting with her tomorrow to figure out how to do an allocation for those residents who live in the housing authority that are eligible for that vaccine. So super grateful to have the support of Tiffany and Tim and Needham, and that's pretty much it for now.
Is that something where they would be coming to Medfield to deliver services?
No, right now they are going to Needham, but we are continuing. But I've actually been in touch with Christine as well, and continuing to explore all options for vaccine. So having conversations with Brewster, because as the vaccine becomes more available, they'll actually come to town and vaccinate those more available populations, and it'll be no cost to the town. It will all go through insurance. They'll be able to claim their billing is a little bit different. So we're just continuing to look at all those additional options as well with the limited vaccine we have in the state.
And then we received, I know Bert has a question, but we received notification that CVS in Medfield is one of the identified CVS locations that will start doing the vaccination next week as well. So hopefully we can follow as many avenues as possible.
And with all of these different sources that are going to be available, they're all presumably, they follow the same, anyone that's doing this has to follow the same rules as far as target populations.
Correct.
And phases, right?
Yeah, otherwise you actually run the risk of losing your right to vaccinate. I don't know if you saw what happened in Georgia last week.
Okay.
Health department in Georgia actually vaccinated an entire school district out of order, and now they're no longer allowed to vaccinate anyone. They're not eligible to receive vaccine because they didn't follow that state's specific protocol.
Interesting.
So we have to, everyone's pretty much following the prescribed, phases. I think it's important to remind people too that the phases don't expire. So, medical, first responder, we're kind of in that phase 1, but they're still eligible as all the phases remain open. So just kind of remind people of that as well.
I have a quick question. We're compiling a list of all the truly homebound individuals in town, and I'm just wondering how we're going to vaccinate those folks.
Is that for me and the board?
That's just open for discussion, and we're just starting to compile our list. So it's just we're thinking about the truly homebound individuals and how are they going to be vaccinated.
Right.
So it's just food for thought, really. I don't.
Yeah, I know the state's, looking into all of those capacities and capabilities. It's really hard to plan when there's no vaccine in play. So I would just recommend, yes, go ahead and collect all that data and information. And if the time comes that we do have a partnership with Brewster, they will support us in that endeavor. For additional, I don't know, I can't imagine that Needham would send someone out, but it's really, and this is really the challenge. It's really hard because we don't have all the information.
Right. No, at least that's a general plan.
Roberta,
yeah.
Kathy and Holly and Melissa registered for the Needham Medical Reserve Corps for vaccinations. And they have been recruiting, I know you're a nurse, formerly, volunteers. So I work with Tiffany and Tim, and they are very much amenable. They just got a vaccine freezer in Needham. So they had registrations for 500 people Saturday and Sunday, 75 plus. They are not restricted to be Needham residents. So they'll get more vaccine. with Pfizer because they have the capability of the freezer, and they, I know, are welcoming because the way the state approved them in their own, so seniors can go. The challenge that we've seen, and I'm sure you know, is getting people comfortable with registering on the prep mod.
Yesterday, we registered 20 people yesterday.
Great.
Yeah.
So that's awesome. That's one of the challenges. But I know that Tiffany and Tim would be amenable to talking to you about homebound people, because that was part of the work of recruiting Melissa and Holly and Kathy. And I know they've said they've got other people that are willing in Medfield to go through the process of registering on the MRC to do volunteer work. So I can put you in touch with Tiffany Zeik, who's the public health nurse.
I've already done that.
Were you thinking more? Sorry.
No, go
Were
ahead.
you thinking more on the lines of these folks getting vaccinated within their homes, or finding a way to get them via a van to a clinic?
Within their home.
And you have a list of these folks, and you were wondering how we would.
Correct. Well, we're starting to compile that list.
Got it.
We recognized in our calls, we're calling everyone that we have their contact information, 75 and older, to find out if they need help signing up, like we did yesterday. We signed up the folks, or we're taking their information. We made a template out of the form, and so we're gathering their information, so we don't have to be on the phone with them. We'll just schedule them, get their time frame, and then get that information to them.
Mm-hmm. Mm-hmm.
In this situation with flu vaccinations, how do these folks normally get their vaccines? Do people go into their homes?
So I don't know what Alyssa has done with the flu vaccine. I don't know. I remember Jane Sniffen, some people may remember Jane Sniffen. She used to go into people's homes. So I can't answer that.
Okay. I was just wondering if there was a pattern to follow.
Yeah.
Through the chair, if I may.
Sure.
Just another thing to keep in mind is that at this time, we've been advised not to move the vaccine once it's been opened. So I think that there are still additional protocols that need to come down from the state. So I think it's really great to get the information and plan for it, but we just don't have that information at our disposal yet. And the other challenge of the vaccine in homebound situations in someone's individual, domicile is that observation period. So it's not like you can vaccinate 10 people and have them in a waiting room. You'd literally be, vaccinating someone and staying within their care and custody for up to 30, 45 minutes, or, 15 if they're otherwise healthy. So I think the state will continue to give us additional guidance as it becomes available. So we'll just make sure that as I see anything, I share it appropriately. But there are just so many limitations on everything COVID vaccine related. It's infuriating.
A question, this is not exactly related to vaccines, Bridget, but a question that I got had to do with, and it's really just to understand whether you or perhaps Carol or other people that have been in the loop with some of the meetings going around, whether there's been any talk about surveillance related to genetic variants, and if there's anything coming down the road as far as the state paying attention to the distribution of genetic variants in Massachusetts.
Through the chair, is that?
Yeah. Go ahead.
They definitely are. The test they have, the PCR tests have been modified to pick up some of the variants, and I know they are conducting surveillance in that realm. One of our most recent updates, state call, they actually spoke to what level of the different variants we're seeing in Massachusetts, where they've been identified, the level or the suspected level of transmission. So I'll get that information over to you. Is really nicely done, and then the CDC has been updating that information as well. So I'll send that to you. And I think the most recent update spoke to, at this time, they are confident that the vaccines that have been deployed will combat these variants. But obviously, as you know, time will tell. But I'll make sure that that most recent update, I think it was this week or last, it's all one long day, but I'll get it. It was actually really nicely done. So I'll send it over to you.
Thank you.
That'd be great. Thank you. Could I back up on something real quick, Bridget, on what you had said about the capacity limits and how there's still enforcing 10 indoors and 25 outside? I've been hearing about a lot of community gatherings up to 100 people inside. And I know that we had a situation this past weekend with a large gathering. I just was wondering our purview as to what we have the ability to enforce.
I want to speak about that first because unfortunately, the police chief was supposed to be here and she just got called out into a different situation. I don't have anything on the record of a gathering of over 100 people. So I just want to be careful how we approach that because there's nothing that the police responded to that had that number of people at. So
I guess my question would be, what if maybe the case wasn't accurate, but if there were to be a case this coming weekend or next week, is that within our jurisdiction to follow up with that, or?
It has to be on at the moment it takes place. So I think this is a conversation that unfortunately we need the police chief to be in on because you'd be asking them to issue the fines. And I know overall, the chiefs of police have not been happy about doing that, but I don't want to speak for our chief.
I understand.
Can I just ask a question? And I don't, so there was Melissa, are you asking in general, if there are gatherings that are large, what the procedure is? I don't know about.
You know, we had talked about this months ago, that this was something that the Board of Health was now given authority to issue fines, and it felt very funny and I didn't like the idea of it. But now that we're seeing a lot of these situations going on and it's affecting our ability to keep the kids in school, and I'm sure that it's affecting contact tracing that our public nurses can speak about, school nurses as well. I think at this point, it's become one of those things where it ought to come up again in conversation. And I respect that we can wait for another time with Chief here.
Yeah, unfortunately, she was planning on attending and then got called out at the last second. So I apologize.
So basically, what is the protocol if, say, I see a party and then how is the response? And then I'm just trying to sort it out. And then how does the authority fall into place under us as a Board of Health if there's this kind of situation? Okay.
So I mean, obviously we're in there's no question that there's some level of fatigue with the all these restrictions on people's lives. And I guess we could say that it does appear that there's sort of been an uptick of people potentially not following all those rules. And so, you know, maybe we want to have a discussion at some point about whether there's something that we can do about that. Obviously, one tool in the toolbox, is enforcement of various kinds, and there may be other strategies as well. It sounds like if we want to have that discussion related to enforcement, then we really would need the police here because they're critical to that. And so should we table that item until the next meeting and make sure that the chief can get here? Does that sound good? I don't want to cut off debate, but on the other hand, I want it to be productive too with, and, you know, and part of that might be also, I think, to see what we can kind of compile in terms of the situation as it is, you know, in terms of, you know, how many problems we're seeing and at what scale, and, you know, and we can consider also whether we have any other thoughts about approaches to addressing that and to try and tamp that down, because and there may be other tools besides the police or at least besides fines and so forth, which seems you know, like it would be a challenge. And okay, everyone okay? I see nodding, so okay. I also want, just to be clean on the agenda, I wanted to make sure we had an item called vaccine distribution update. I think we talked about a number of aspects of that during the health agent update, but I didn't know if there was other discussion or related to vaccine distribution, whether that's you know, at the Council of Aging, or we talked about homebound. Is there anything else there to discuss, or are we up to speed? Kathy?
I'll just throw it out there. It's not time yet, you know, phase wise for teachers, but I had also reached out to CVS, where they've done our staff flu clinics in the past, about doing, you know, possibly doing a clinic at Dale. So we're actually 3 of the schools, but so just in the process of investigating that right now. Nothing's been, you know, we don't have any dates or anything or any commitments from them, but they did have a process in place for employers that want to vaccinate their staff. Okay.
And so that would be something that you'd be planning ahead, but it wouldn't take place until that target population was eligible.
Yep. Right. We're on the 75 plus. We have to get to the 65 plus, and yep. So we'll get there, but it'd be nice, similar to the seniors, having it in Medfield, of course, is as was with the flu clinic, so much more convenient for staff that, you tend to have better compliance and all if you make it ultra convenient. So, and they bill insurance, so there's no cost to anybody, which is great.
And is there I just for clarity, is there a plan in the works as far as actually distributing vaccines at the COA site?
So I have been in touch with Medfield CVS and also have put calls and emails into the corporate office of CVS. So I have it out there. I just wait and see, I think.
Okay.
Yeah.
All right.
And Dr. Marsden may speak to, he's investigating some other avenues also. So he may speak to that, but we don't have a definitive plan at this time. Again, it all depends on, if there's vaccine available or when the vaccine becomes available to that group. Yeah.
Most of you probably saw that Newton Wellesley Hospital, for their people, will be standing up the TripAdvisor location. I know that isn't good for homebound people and people that are reticent to drive, but might be there are more options becoming available based on people's certainly adhering to the phases, but that was approved and will be a viable spot, easier for our people than to go into Fenway. But I know many have gone to Gillette too. The challenge has just been the registration.
Actually, the process going through Gillette for the vaccine, one of my seniors just reported, was very good. They've ironed out all the kinks.
Yeah.
That's
So,
great.
yeah.
Yeah. I also brought a couple seniors and it was seamless. It was really so well done, and nice photo op with the stadium in the back.
Kathy, that's great to hear, both of you.
But I can, that being said, I can see seniors would prefer to go to the Council on Aging and be vaccinated there. That would be, a wonderful thing to do. I mean, Gillette can be, you have to drive there. You have to,
So let's see, I have an item on the agenda.
Thank you, Roberta.
What's that?
I just want to say thank you.
Oh, you're welcome.
Well, actually, it's 4:29, and I think I saw Dr. Marsden in the attendee list.
So goodbye, Roberta.
All right, bye. Thank you very much.
Thank you for coming.
And I think Dr. Marsden and Jessica Riley are both here. So let me.
Okay, great. Great.
Hi, everybody.
Hi, Dr. Marsden.
How are you?
Hi.
Hi, Jessica.
Hi, all. How are
Hi,
you?
Jessica.
All right. Thanks for coming to give us a little bit of an update in terms of what's going on with the schools.
Sure. I appreciate the opportunity. Thanks for having me at your meeting. I know that you folks have a busy agenda as well. So just want to update a few things if I could. I just caught the tail end of what Kathy was talking about in terms of vaccinations. So I know that she's been working with CVS. I've had 2 conversations this week with Cataldo Ambulance Service. Also trying to set up an on-site vaccination clinic for our staff. So I think once we get the information and once we're in the queue for educators, then we'll have a plan either way, whether it's going with CVS or Cataldo, to try to bring that to our teachers and our staff. We don't think it's a great way to have people running around to different places. We want to bring it to them like we do with the regular flu vaccination every year. So that's kind of what our plan is, and we want to make sure that we can provide that for people. In terms of our sports, as you know, we put a pause on sports for 7 days. We resumed sports on Tuesday after the 1-week pause. It seemed to go well, and I know that I forwarded Steve the email regarding the notification of that, and also the notification that Eric sent out to coaches, just to kind of keep you guys in the loop on that. Looking at our numbers, we do have a couple more today, but it looks like it's been slowing down a little bit compared to last week. I don't want to jinx us, Kathy, because I know that our phones light up constantly with that stuff, but it seems to be slowing down, so that's good. I know it's slowing down statewide as well in terms of numbers, so hoping that trend continues in the right direction. We continue to utilize the Binax antigen test. That's been really, I think, a godsend for us. I know that when I signed the district up for that, as with everything we've done with it, Kathy has jumped right on board and wanted to support it and really lead the way with the nurses. So that's really been super helpful for us. I know that she's been operating the clinics with our nursing staff, and they've been fantastic with that. And I know there's been a little bit of controversy around the use of that test, but DPH has endorsed that. And I know that once we start to get into the pool testing, that's going to be a reflex test for any required reflex test for anyone that shows up positive in the pool. So Kathy, I just got an email about 20 minutes ago from the third-party vendor around the pool testing. So we're good to go. They have all the sign up stuff for us to do, and we'll connect on that tomorrow and get all that straightened out.
Great news.
Yeah, so we're really excited about the opportunity to provide pool testing for our students and our staff. I think what Kathy and I and Dr. McCullough have talked about is really try to focus on the secondary level, the middle school and high school to begin with, because that's where a lot of our action is as far as transmission or positive cases. So we want to make sure that we're able to, really get a sense of surveillance of what's actually happening and what is there real prevalence in our schools, and whether or not, I know that, a lot of the reading that we've been doing around asymptomatic and whether they have the viral load even to transfer is something that we want to be able to consider as well. So that's exciting for us to start. And once Kathy and I sit down tomorrow, we'll probably, we'll set that target date with the third party vendor to kind of get that going.
Jeff, could you explain to people on the call listening in perhaps that what pool testing is? It's a PCR and all of the other things. Thank you.
Yeah, sure. So the pool testing will allow us to do several samples in one group, and then they'll test that group. And if someone in that group is positive, then everyone within that pool of people, whether it be 15 or 20, whatever the number is, they'll be tested after that to see if we can pinpoint where the positive person is. So it's really an efficient way to do surveillance testing of large groups of people. It's also really cost effective because you're putting them all into one sample instead of having 15 individual tests. They're all into that one pool, so to speak. So, Kathy, if you want to add anything that's different from what I said.
Yep. So again, it's much less expensive than having it done individually. And we would do it by classroom. Probably at the middle and high school, we would have to do it in one period. It's all voluntary. There'll be consent forms that'll go home to parents, both for, staff and for students, and, be offered obviously to staff at all levels. But we thought we'd pilot it at least, at the beginning, at the middle and high school. That's where all our cases, the elementary cases have been 9 or 10, since we opened in September. So and most of those have come from older siblings or from parents. Mm-hmm. So I think that makes sense to start there. And again, it's the PCR test, the gold standard, which is much better. And we're already set and used to using the Binax test. So if one is positive in that pool, and most of the schools that have started it already, they've had very few positives. So it's not like every day you would have positives to do, but you would then do the Binax on them. If you couldn't pinpoint it with the Binax, you would have those people in that group do a PCR. And you wouldn't do all the staff.
Is that a nasal swab or is that a
nasal swab? And
okay.
Kids above 2nd grade can do it on their own.
Great.
Yeah. So no, I think it'll be great. And hopefully it'll be, very quick and, give us a good sense of where we have any infection in the schools.
And I think it's, another really important data point for us to look at as we continue to reopen schools. So we have our preschool and our kindergarten in full time right now. We're looking at getting our 1st grade classes in full in person after February vacation, and then taking a look at what 2nd grade, whether we could do that or not, and then see the timing of the vaccination. Because I know, as I said last Thursday, it's our hope and our expectation that once we get all of our teachers and staff vaccinated, we'll be in full. And we've set a target date of April 5th for that, because we need to have a target to work toward. We need to get everything in terms of getting everything ready to get the kids back in, the furniture. Like, there's a lot of work to get done that you don't think of in terms of getting everyone back. And there's a goal that we have to set. And I think that Jess Riley and I talked about this weeks ago. We worked backwards in terms of when we thought, of course, it's going to be a little bit different now with the change in teachers, but when teachers would get their 1st dose, their 2nd dose, and then 2 weeks after, we could logically think that April 5th would be a good target date to get our kids back. So I think that's where we are right now in terms of looking at that, and we feel pretty comfortable with that moving forward. And we just really, any help that the Board of Health could give us with making sure that vaccinations happen, and any advocacy that you guys can do with that. I know we've been trying to beat the bushes as much as we can to try to get folks, really trying to look at, my group, the superintendent's group, I'm a co-president of the Tri-County Superintendents, and we sent a letter to the governor this week on Monday with 42 other signatures of other superintendents on there, asking them to really look at the prioritization of teachers and getting them up higher to where they were, at least to where they were before the change was made, because there's a lot of places that want to get kids back into school. We see that as a critical component to getting kids back to school. So
getting kids back to school physically full time, because we are very much back to school. It's, you can laugh all you like, Stephen, but I get a lot of flack about that.
And I think
and we all want them in school as much as we can, but we want it safely, and we want
Jess, that's a really important point, because when you hear about, like, for instance, the new head of the CDC saying yesterday that reopening, you don't need vaccinations and all that. And I've had this conversation with parents too. When people are talking about reopening schools, and they're talking about the ones that have been remote since last March. That's their context that they're saying. We're considered reopened already because we're in a hybrid model. There's reopening in full in person is different. But when they're talking about reopening, they're talking about folks that communities where kids have not entered a classroom since last March, as Christine is pointing to herself where she lives. Yes, that is correct. So that's the real push there, is to make sure that those are, and I think that verbiage kind of gets lost a little bit in the conversation. But we're looking at full in-person, and that's what our goal is for April 5th.
Steve, can I make some questions and comments on that? Steve?
Yeah, go ahead.
So I guess my question is, number one, after the teachers get the first vaccination, you are 85% immune after 10 days. So I don't know if that needs to be a consideration, that they don't per se need to be fully vaccinated with the dose number 2 and, the 7 days thereafter, which brings you to 95%. It may be a consideration that after they get the first dose, you can send them, you can tell them that they can feel pretty confident that they're relatively immune after 10 days after that. And I'm also wondering, I know a lot of the towns nearby the teachers have gone back without the vaccination. I mean, healthcare workers, we've been working without a vaccination on top of COVID positive patients for 10 months and have felt pretty confident that we're relatively protected. So I'm just wondering, we don't really have a timeline for the teachers getting vaccinated, and April 5th is a long way away, in my opinion. So I'm wondering if there's any conversation about going back more without the teachers being fully vaccinated, especially considering there isn't really a plan per se coming down from the state quite yet. I mean, of course, we want the teachers who want to be vaccinated as quickly as possible, and we'll do everything we can to support that. But, that's just not in the pipeline right now, and the days keep ticking by. That's just my questions and my comments regarding that. But I do think that that's something, Dr. Marsden, to consider, that after the first dose, you may be able to expedite the school opening, because you get a pretty good bang for your buck after the first dose after a short period of time.
Okay, thank you.
So can I just clarify? So Holly, I try to take notes. So your question was, is there any conversation that the teachers could go back prior, perhaps after first dose, and because there's no timeline? So I would say, I think that's what I heard your question at. Is that right?
Or even prior to vaccinations at all. Some teachers have gone back without being vaccinated, and I know, again, they're 6 feet away with.
That's the key part,
okay.
Right? So our teachers are back now without being vaccinated. They're 6 feet apart, just like what you're describing is other districts that are open. They're opening at the younger grades, and they're 6 feet apart. And actually they're 5.5 in Dover, but they're 6 feet apart. It's not like they're all coming back at 3 feet or 2 feet or 1 feet without vaccinations. That's just not the case, Ollie.
No, but they'll be 6 feet
apart. And also, I also have to say, and I
you
think that I've spoken to Stephen about this, that there are considerations outside of the specific health guidelines that we have to think about in terms of getting kids back. And so I think that the BOH's role is very much around giving us information about how to make that happen. But I really am concerned that this is not actually the venue to have a debate about what is essentially, kind of a labor and employment issue. It's very, very necessary to get kids back to school, but this is not the place to be talking about how we plan that. But I do appreciate your information, Holly.
Well, let me just say, I'm not having a labor. There's not a labor discussion about this. I'm talking about vaccinations and public health only.
Right. So you've given us the information about the vaccination, but now we're going into timeline, which is very much within the school's purview around working with our employees and working with our unions. And that's just simply something we cannot talk about here.
Yeah, that's totally understandable. That's not the conversation I'm having. I'm having a conversation about the vaccinations and the timeline and the fact that we don't really have a timeline. And I mean, there is a public health component as well to the mental health of children that I think is in our realm. And again, I'm not having any type of debate about collective bargaining or anything regarding that. I'm talking about public health issues regarding mental health. And, you know, if the teachers can go back and feel confident with the vaccine after a first dose, or even, you know, just know, even if they come back with the children full time, they are always going to be within 6 feet of the students. They're never going to be less than that, even vaccinated or not vaccinated, regardless.
Okay, so we received the information. I hear it and I understand what you're saying. And if we're going to have a larger kind of mental health conversation about this, you know, maybe we should be bringing in kind of other areas.
Yeah, Carol's very good with our Carol is sort of an expert in mental health as well. And that is a public health concern always. So I don't know if Carol.
I am myself, I'm a social worker. Thanks.
So
I do understand that. But at the same time, I think that we're trying very hard to make sure that that we are attending to schools and education. There's not a single person here who doesn't want to have our kids in school full time all the time. But unfortunately, sometimes there are things within the educational realm that we absolutely and operationally that we simply can't discuss within the BOH, and that I'm not sure is appropriate necessarily for us to be discussing here right now. You know, like, so I completely understand. And I know that we are trying our best to get our teachers vaccinated, and that we are doing everything we can to keep them safe. And we do want them back full time. There are operational concerns that we have to deal with, and there are labor concerns that we have to deal with. So
understood, but I'm just, if the teacher vaccination conversation doesn't come up with the Board of Health, I'm wondering under what realm it would come up. I mean,
but it has. Right. So the teacher conversation has come up, and we've talked about that there's an 85% immunity after the first dose. And that's duly noted. Thank you. That is not information I knew beforehand. And that there is 95% immunity after the second dose, which is fantastic, assuming that that's the vaccine we get and kind of what's going through the pipeline right now. And I absolutely hear your concerns about child mental health. And parent mental health, quite frankly, and community mental health, and all of this. We would all like this to be over, but I'm not sure that that kind of anything beyond that is necessarily something that we want to be talking about here right now, right? We've talked about kind of how we do it in terms of the health aspects, but you know, it's not for lack of will that we don't have kids, or lack of creativity. You know, it's just that there's just nothing. We have put a plan into place. I know that that is not absolutely certain, but I would ask anyone to tell me what has been absolutely certain this year, right? So, and I'm not kind of like pounding on you specifically, but I do think that this has been a conversation that we've had with Stephen and with kind of in general, that like, how do we stay in our lanes? Because we desperately do all have this one goal, which is getting our kids back to school.
I'm just gonna back up on that one statement. So you said we've had conversations with Stephen. I just want to be clear for the listeners on this call that the Board of Health has not weighed into any decisions that have been made since the August opening, because we have not been asked for decisions, and that's fine. That's not our jurisdiction. However, I want to just make it very clear for those listening and for everybody here that the Board of Health has not weighed in. So there has been a lot of talk in the community about what the Board of Health's opinions have been in the guidelines that we have recommended up until this point. And it is absolutely untrue.
Meaning that there are people it appears that the people have the impression that the Board of Health has a greater role in these decisions than we do. And so, you know, you're kind of giving guidance to say, please try and step back a little bit to some extent from these and stay in your, to quote you, to stay in the lane. And I respect that. You know, at the same time, we do want to communicate to the public that it is your decision, it's not ours. And so if they have a problem with it, it's not because of us. And so that's where I think the tension is to some extent, because in some of these cases, you know, where obviously we want to support on health issues. For example, I don't think it would be.
We desperately want your advice.
Yeah,
in
so
that
I
way,
don't think
the
it would be.
facts.
I don't think it would be inappropriate necessarily if you have, as you develop plans for reopening. What I mean by that is going back full in person and staging that, maybe starting at younger grades and moving towards something. There could be aspects of those plans that it would be reasonable for the Board of Health to be aware of, because they do relate to community health. Because you know, just as we participated with you in designing the plans for the hybrid model in the summer, in order to consider the various trade-offs and risks, I think that as your things are going to be changing as you start going back.
Right.
And there are probably things which it would be appropriate for the Board of Health to be, that fall in our purview. At the same time, I do respect that while we are as individuals, parents and so forth, and have viewpoints related to school policy, you know, we don't have a role in really deciding when you go back and how you go back with respect to, you know, all kinds of operational issues. And but it, you know, we have you know, I see the same questions in the Q&A that we've seen several times about what is the Board of Health's opinion about this and that related to reopening. And I think at one point you asked us for our opinion about things like 3 feet versus 6 feet, like what metrics there should be for reopening earlier in the fall. And we've shared those. And
we'll need those again when we can operationally make this work. And we have the other kind of barriers gone. It's
right.
And, you know, like, as you know, I think I mentioned to you, we have to be eternally vigilant, as you guys do too, about our kids' health and safety and our staff's health and safety. And sometimes I'm afraid that this gets into like kind of a runaway train, right? Where everybody starts to say, but we need to be back, we need to be back, we need to be back, based on evidence, or based on not evidence, but on kind of the comparison about, well, that community did it, that community did it, or I'm not understanding quite exactly what back to school means to these other communities. There's a comparative aspect. And I'm not saying you guys did it, but I am saying that we have to be very careful, and we have to kind of be assured that we're talking apples to apples and oranges to oranges. And that, Holly, I absolutely respect your concerns about, you know, about child mental health. Trust me, this is, yes. And I absolutely respect that every single one of us at the school department and here are absolutely concerned about how our kids are moving forward, what it is like for them at home on the days that they are home. I get all of that, but let's make sure that we're asking each other for this consultation, you know, and we're going to want to know, you know, one of the things that I'm personally the most kind of concerned about is the variant. I'm so glad to hear that they have increased genetic testing. That makes me feel much more confident. But at the end of the day, we really have to, you know, Dr. Marsden and the school committee, we're the ones who have to make this decision around, 2,500 members of our community in a very granular way about that level of risk. And so the more that we can have kind of that information is really important. But there's also operational parts to this too that are difficult to just get around.
No, understood. And that's another question that I'm glad you brought up, the variant. We're not entirely sure how well the vaccinations are protective against the variants. So this COVID crisis is not going to be over in April, May, June, or July. And I'm just wondering where we're going moving forward. Everybody's vaccinated. We can go back April 5th, and then information comes out, which comes out daily, that says these vaccinations are not protective against the variant. Where do we stand as a town? Moving, and again, this is an operational question and this is for your team to debate, but I'm just saying this may not be, the vaccine is not a magic bullet to cure all of this. And I just think everybody needs to keep that in mind. Masking, air ventilation, safe distancing, these are the things, again, that have been proven over and over again to prevent spread. So I just don't want it to be, this one thing that everybody takes into consideration aside from the schools. In general, I mean, having a vaccine does not make me go into a supermarket and not wear a mask. We still need to be vigilant. But we also do need a plan moving forward, again, regarding the mental health of our students. Oh, yeah. And that's really my only concern. But again, I'm not trying to get out of our lane here, but I do think that there are some issues regarding the schools that are in the realm of the Board of Health, which are public health concerns. So we're always here and available. And we do have a board that's got various diversity with expertise, and we're happy to provide you with any assistance we can. We have not been really asked up till now, but we're here to help.
I hear you. I know, Holly. Thank you. And maybe part of what comes out of this conversation now is that at some point we do have a conversation about the ways that the school and the town are joining around mental health support and various ways of doing that. I never, ever want to say or use the word uncharted or pivot again after a certain point in my life. But I know that this goes on, and there will never be a fireworks moment where we're popping the cork off the champagne and saying, it's over. Normal is going to come iteratively, and there are going to be ups and downs, and we'll have to respond to those as we go. But we have to just keep on plugging. And I think we are trying to keep on plugging, but we also, I think, feel a level of needed caution too. And it's hard. These are not decisions that I think either one of us, any of us, want to just sit with. We don't want this to be the truth.
Yes, I see Leo Brem's hand is up as another school committee member. Just wanted to, it seems like he might want to say something.
Actually, I just want to comment as a community member about, the role of, that from what we're hearing from the community. And of course, I do wear a hat on the school committee, so I'm hearing it from that perspective too. I think what's important is that that between all the boards in town, that there is a communal view of working together. And I think that is something that, communication out, I know Melissa brought up in the last meeting, which I thought was extremely important, is about solid communication from all the boards about what needs to be done. And as a community member, hearing varying opinions from different boards, I think causes the message to the community to be muddled. And I think one of the things that would be helpful moving forward as we move to full back and vaccinations and everything else is a solid messaging from all the boards in town about what the plan is. And it would be helpful for the community to hear that, so that they know that the people that are working for them are working together for the best of their ability to keep everybody safe, to get our kids back to school in a safe manner, so that parents can feel confident that it's okay to send their kids back. Staff know that this town cares about them being here, because it is our teachers that make our schools what they are. And with that solid messaging, I think that it'll be extremely helpful as we and I'm the forever optimist. So, as we are making our way out of this, which I feel like we are, with our numbers down in the state and vaccines on the horizon, and someone posted that there's 1,100 open slots at Gillette for vaccination. So, those are all wonderful things to hear. And I just think that's the only thing I want to put as these two committees that are before me, as again, I'm talking to you as a taxpayer and as a community member. I think it's just important that really just needs to be, think about that as your messaging goes out. If we can put a school, a little school spot on Melissa's sandwich board, that'd be great, like a little school section. And the mask signs are a great idea. I think that those things are all great, and that'd just be really helpful for that. So, and that includes any of the messaging around whether vaccines are safe. Like that's the first I heard from Holly as well. And I know that you all have various strengths in your professions and your experience, and that's why you're on this board and you're appointed to this board. And and I think that's why we're looking to your collective wisdom as well as a community to hear, what is safe and what is important for not just schools, but all the after school programs, going to Starbucks, going to Noon Hill, and so all those things that make Medfield make Medfield Medfield. So, and I guess that's my only statement. And thank you for giving me the opportunity.
Steve, can I just clarify that, if I might, since I don't know Leo, but I appreciate the comment. I just want to be clear. What you're looking for, it sounds almost two different things, but you're basically, from us and our board, hoping for more community education and wellness in general across the lifespan. Am I correct on that? Separate from, you said, the school plan and the health impacts of that, which is a bigger and more complicated to have blended messages. But I just want to clarify what I thought I heard you say about public health information, health information for the community. Is that one of the things you're looking for?
He is not there anymore.
Oh,
Sorry.
okay. I just like to.
There he is. Gary's back.
Sorry, I think when I muted myself again, so I think that reset me. Yeah, it's clear messaging across the board, whatever the subject might be. And in this case, it's around schools, right? And that's what you're doing here. And I think some of the confusion that gets fired up on social media and gets parents really upset and get, from the parent to school perspective is the messaging that they get from Facebook and the messaging they get on TV. And just like Dr. Marston said, CDC said, those kids can get back to school now, and people are, emailing folks and saying, putting on the page, okay, time to roll them back. What are our schools doing, right? And it's that mixed messaging.
Yeah, go ahead. Sorry.
Yeah, and it's that mixed messaging that I think, I know you can't solve it, but you can definitely help support the messaging with the other towns from both, because I know it's not just schools you guys work on, right? You're the Board of Health for the whole town on everything that's health related in town. But whether it's from schools to, supporting, the supporting of pushing back large gatherings. I mean, I don't envy you having to be in that situation to critique, someone's, 75th birthday party that had 100 people at, right? So like,
don't spread any more rumors.
Oh, sorry.
You missed the first part of that one, Leo.
Oh, sorry. It was a good party. You should have been there. So
I appreciate that clarification. Okay. As a board, I know that we have the ability and commitment to share health information across the lifespan. I speak for myself and I welcome the board, but we don't send out information on behalf of the school. Kathy does that.
Sure.
She's a really great job. I've been forwarded some of the information. So I'll clarify that. We we prioritize information from the WHO, and you'll find citations that we've had the CDC, and for public information on any topic like you mentioned is something that we have talked about and is one of the topics later in our agenda. So I appreciate that input. I just know that as far as sending out safety and messages on behalf or related to the school, that's not what our
no, it's just like you said before, and similar to how Dr. Marsden went to advise on the masking and everything else. The next the big debate, 3 to 6 feet, right? Hearing deliberation from the board in town that is trained, is privy to the WHO and the CDC information and can decipher the really large words and some of that in that jargon. There is countless pages of information about returning to school, opening your stores. And so I think hearing the deliberation and understanding the perspective of what the Board of Health deems as safe, is the type of message, is I guess the messaging and helps us inform what we need as well to also make decisions, right? So we can inform our decisions as well. So and that's not about staying in lanes and everything else. It's just we're not epidemiologists. I am not a physician's assistant. I don't work at the Chan Center. Like I respect all the things you guys have as a whole, right? And the same, on the flip side, you may have not done first grade lunch duty. And I can show you how to do that too. So, but I guess that's my messaging. Is about being able to inform and being able for us to take and listen and hear that feedback and hear your opinions on this subject matter. And I think that's what will instill confidence in the community again, or not again, because I don't think we've lost confidence, but I think it will help support the confidence in the public bodies in town, if the public is to hear that kind of, collaboration and back and forth. So.
Mm-hmm.
Yeah, if I can.
Thank you for clarifying.
I think that, and I want to kind of do this, hopefully also kind of acknowledging the questions that have been submitted, which I think are a theme, and perhaps just from 1 or 2 people, but nevertheless, there are several of them of a similar theme. But at the same time, just sort of to pull together these threads, I mean, I think clearly the Board of Health obviously wants to continue to be supportive of the schools in any way that we are asked to do so, and in any way that where we see a clear role. I think at the same time, I want to sort of set this up with the kind of questions, because I want to acknowledge also what we get from the public and some of the tension, right? And so that the public also understands that our role is at best secondary and really constrained to a set of issues, I think, related to health aspects of implementation or things that we're asked about that are related to disease transmission or community risk and so forth. But that ends up it's a piece of information and input into a decision that the schools make that has other considerations, but ultimately it ends up being the school's decisions. And so, there are decisions that you guys make where you've asked us for input related to, school sports and transmission, and we give our perspective, and you act, but right, and I think by and large, that can work well. There's a question in the Q&A from Mike Mattioli, and that it's repeated a few times, but it's, in the Board of Health's opinion, should children be back in school full-time right now? Why or why not? And I just wanted to flag that as sort of the type of question that we don't really want to answer, because or at least in my opinion, I don't think it's constructive for the Board of Health to answer that question, because it considers too many things that are beyond the purview of just health purely. But there are questions that we can answer that are more targeted, like what is the evidence and what are the trade-offs with respect to how many people are in school, in a classroom, and the distance between them, and so forth. And at earlier points in time, the schools asked us to weigh in on that, and we did our best to do that. And I don't think our opinion has changed from what we said before on that. But I just wanted to flag, and I don't know if Dr. Marsden or Jess or Leo, I mean, there's a lot of, questions here, like why has the Board of Health not been asked for their opinion by the school committee? I mean, I think that there are issues at different points in time since the COVID crisis happened. There are several points in time where Dr. Marsden has reached out to the board for our opinion, whether going back to the original in March, we had, I think, 3 meetings in 2 days about, whether we should close and for how long and so forth. And then, there were different points in time in terms of developing the plan for the fall, where we were involved. And, but so I think it's a fair characterization, perhaps, to say that the schools have asked for our opinion when they wanted it, and we have tried to give input on that. I think that probably there are moments in time, because nobody's perfect. There's definitely been moments in time where people on the Board of Health have felt like maybe they should have been asked about certain things that came out, and they weren't, or maybe only I was asked, and so that creates a tension. So that stuff, we haven't been always perfect, because we're human and things are fast moving and there's a lot of moving parts. But I'm probably partly responsible in that sometimes I get asked things, but that's not necessarily the whole board. That's just me. So anyways, I don't know, so there's this question here, why is the Board of Opinion not being asked its opinion? And I think I kind of tried to answer that as best I could.
Mr. Chair, may I?
Yeah, go ahead, Dr. Marsden.
So just, again, I want to just reiterate what I did at the last meeting, how much we appreciate the collaboration, support, and opinion around certain issues that we run into. And I think that whenever we've had any issue or any question, you guys have been open to it and give us the honest answer. I know it keeps coming up about Board of Health and 3 feet and 6 feet and all that. I mean, you guys were crystal clear in the beginning of all this in the fall that 3 feet at the lower levels was something that was acceptable. And you've been very clear about, and you haven't, as far as I know, haven't changed that opinion. No. So, I mean, it's, that 6 feet was better, but 3 feet wasn't wasn't something that was inappropriate. It was something that was acceptable at that point. So you've always been, very clear on that piece. The other thing too, I want folks to know is that Kathy and I run a lot by our school physician. So we have a school physician for this reason, where it's not just to write standing orders on things, it's to collaborate, consult, and all that. And we do that, Kathy more than I, but certainly do that all the time. We were exchanging emails earlier today, Kathy and Dr. McCullough and I. So that there's that ongoing communication that happens with a medical professional, a pediatrician, a public health expert, so that she gives us her feedback as well. So it's not like we're just doing this in a vacuum and then every once in a while we say, hey, Board of Health, what do you think? I mean, we're doing a constant collaboration in consultation with our school physician on these issues as well. So, you know, I know I was only here to give you an update and it's, you know, 45 minutes later. I really appreciate, you know, your input in the support that you've given us through this whole thing. And I know that once we get closer to a full reopening, that we'll be back, you know, asking for your input on certain items. And in terms of the vaccine, the commissioner has told us that we can expect a lot more vaccines coming out sooner rather than later. And essentially that it started off as drip, 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 and it's going to be a fire hose by the time educators are up. And that was good news. And he told us that last week. So I'm hoping that holds true because I look at some of the data around the country and I wonder why we're lagging so far behind other states when we are the medical central of the world here. It doesn't seem to make much sense to me, but here we are. So again, I just want to thank you for the opportunity today, and you know, certainly happy to answer any more questions. But you know, you have an agenda that you have to go through as well.
I just want to. I do see. I think Dr. McCullough with her hand up. Do we want to recognize her? Since you mentioned her by name, I feel like I can't ignore her hand.
Sure.
Actually, Steve, can I quickly clarify that I, just because of something I saw in the comments, that I said that it is not safe? I don't think I said that. I think I said that we are constantly thinking about safety, and that's really part of what we have to think about all the time. But I don't think I ever said it was not safe. And if I did, I will have to go back and look at the tape because that was certainly not what I intended. So, but thank you. Sorry, Dr. McCullough.
Dr. McCullough just said she's saying hi and she was listening, but I don't see her.
So that was just a wave from her.
I think she was waving.
Okay. All right. All right.
Not managing my emojis very well.
Yes. Yeah, so I'll just, we have one more question here from Chris McHugh Potts. It says, can we please just make sure our local Board of Health does not relinquish its legal authority to create health regulations to protect the community? That does include schools. It's no different than the school committee creating school policies. I don't believe most people understand the roles and responsibilities of their local Board of Health. According to the Association for Boards of Health, the broad legal authority to pass local public health laws is somewhat unique to Massachusetts. And the Massachusetts Supreme Judicial Court has consistently upheld local Board of Health regulations. As a community member, I respect and appreciate the strong role of our local Board of Health. And I guess maybe
I don't think any of us disagree with that.
Yeah, and I think we're not, I don't think we're trying to relinquish our legal authority. And you know, I think we've talked about that also, that obviously that's part of the reason we like to stay in communication, particularly on, you know, I think it's you know, more where you would see a, let's call it interventionist Board of Health, would be more in the direction of, if we saw something happening that we felt was unsafe, that put the community at risk, I think you would see us being more assertive in that regard. But in the other direction, it doesn't really follow that we can insert ourselves necessarily into, you know, things that are other committees' jurisdictions, where there's not, you know, I respectfully to Holly, of course, there is an aspect of a negative health impact of schools not being in person. And so, you know, through that lens, you know, there might be a role, but in general, it's, you know, I think that's, in any case, I don't think we're I didn't really mean to say anything that would suggest that I was, that we were trying to relinquish our authority. We keep that, and we stay, I think, you know, protective of that. And I don't think, yeah, so maybe I'll just leave it at that. I don't know if, I just want to make sure that the other Board of Health members, if there's any more comments from you on this topic, that I don't want to cut off debate, but okay. So should we leave it there? I'm seeing nods. I'm not seeing happy faces, but I'm seeing.
It's late.
Okay.
Thank you very much. Appreciate the
it.
time, certainly. And we do and have really appreciated your advice, when very much so, you know, and it really is towards one goal, right? It's towards making sure that our students and our town stay safe, and that we're always monitoring that. And that's what you do, and that's what we try to do too.
Thank you, everybody. Appreciate it.
Thank you.
Thank you.
There's one more came in, but. So I just want to, there was one more question that came in, just to, I think, just to read it out so people hear it. So Tara Olivero, it just seems as though the board who oversees public health during a public health crisis, you don't want to make a decision on public health. It seems as though you are suggesting we leave it up to the educators. I just want to clarify your statement and stance. I know many members in the community would feel better if you weighed in, as August 2020 and February 2021 are very different. So yes, so I appreciate that sentiment. I think what we're kind of trying to communicate is that it's not that we're leaving it up to the educators, it's that it really is basically their decisions as far as operationalizing a return to in-person. And it, you know, you don't, I mean, and I would also say that if you look back at the meetings that we've had and the materials that we put out around the summertime and then in the fall, you know, you do kind of probably get a perspective of what the Board of Health has said about these things. And I guess I just don't know that, you know, the schools do ask for our input at times on different aspects of policy as it relates to the pandemic. But, you know, yeah, so I don't know. I don't really know what to say about that, but it's not, we are here to try to provide information related to risks, related to public health risks. And also, I think another area where we feel it's important to be involved is with respect to any, you know, obviously anything that's happening within the schools that, had an impact on public health risk outside of the schools is naturally something that we pay attention to for sure. But, aspects of the school reopening that are related to, labor negotiations or specific dates or which, those kinds of things, really, I kind of feel those really have to stay with the school committee, even though I think all of us honestly have, opinions one way or the other about school reopening. A lot of us are parents with kids in the school, but it's also, I think it's just, we kind of want to stick in a way to what we get asked to weigh in on. Or I think also, obviously if there's something that we feel compelled to weigh in on because it's putting the community at risk or something of that nature.
I think also, Steve, if I can say something, I think
yes, so help me out.
It's not a totally fair, it's a fair question. It's hard for the Board of Health to answer that because the Department of Elementary and Secondary Education makes the elected officials of the school committee and the superintendent the authority to open and close school. So the Board of Health can make recommendations. If hypothetically the Board of Health thought everybody should be open tomorrow, you could vote and make that recommendation, but it's up to the school committee and those elected officials to make that decision. So you're making recommendations to them. You can't make those decisions. So, I don't think that I don't see this as not making a decision on public health.
No, I agree. I think that everything we've sort of discussed regarding teacher vaccinations, 3 feet versus 6 feet, we are coming at it from a public health perspective, and we are happy to make recommendations regarding data and research studies and committees that we sit on and things of that nature. And I think people misinterpreted me saying that I was getting involved with when and if schools should open. I was, again, only talking about the public health aspects related to school reopening. And I do feel that that was within our realm. So I just want to reiterate that. And if we were asked, we would be happy to deliberate, take a vote and make a recommendation. But again, we have, as a board, we're happy to collaborate when people want to collaborate. And we have collaborated with the school committee and Dr. Marsden on some issues. But, perhaps if the public wants us to be a little bit more involved, on these, they're always welcome to reach out, and we can reach out to the school committee if they think it's something we should, make a recommendation on moving forward. Whether or not we've tended to sit back and wait for maybe them to come to us if they wanted. And they have they're not just looking at it from a public health perspective, they're looking at it from a variety of perspectives, and we're not privy to that information, nor is it in our realm to do that anyhow. But,
not sure I would want to be.
I wasn't coming at it from any other perspective, but a public health perspective is all I have to say about that.
Right. Steve, can I add one more thing? I understand Mass General Law 111 and our statutory authority to make reasonable health regulations. I understand, we all understand and respect that. If there was a tenuous, threatening health situation in our community, no matter what location, venue, whether it be, salmonella in a restaurant, I'm giving hypotheticals, or any kind of infectious disease, a TB situation, a Board of Health can, yes, and hopefully is informed through Christine and police and fire of a situation that's a health threat to the community. And then a Board of Health can and should and is a partner in acting to put restrictions and restraints into place. I'm listening to this conversation. I understand so many different levels, and I'm sorry that this whole 10 months has been the stressor that it has been for parents and educators and staff. But I I agree with Christine. And we're on these calls. The governor and DESE gave the authority for the policies and procedures of school operations, final votes to a school committee. And in addition, they have collective bargaining to deal with. So I am speaking because I'm clarifying that we've respected that. And there are going to be things that are beyond our purview as far as policy. But that doesn't mean that this board, with the experts that we have, in any community situation, would not be involved when there's a threat to health and safety. And I am obviously speaking as for one person, but I feel like I speak for all of us. And then having Kathy join our board this year, I feel is rounded out what our capabilities are. So we have talked and understand that we do have the authority for a health threat to make a decision on any kind of procedure or activity or restaurant or and step in. But as far as the authority of school operations and teacher contracts, we don't get involved in that because we're not seeing and understanding that there's a threat to public health. Is that, I'd like to hear Melissa and Holly and Steve and Kathy, just because I didn't expect this conversation today, but I want to be respectful to people that are listening and concerned, as well as to Christine and Jeff and all of us as board members, including Kathy, who's anyway.
Well, I do think, from a school perspective that we really appreciate having the Board of Health's expertise and all the different people with their individual expertise weighing in. I think that's been great. Again, some of it has just been directly to the chair, Steve Resch, because he was the appointed liaison. So I think sometimes it went directly to him and not the whole board as part of that. But I think the school very much appreciates having, the backup of the Board of Health.
And when there's a concern you have from a medical or a health and safety standpoint, the board, you bring that to the board for community health, right? And the board is prepared, like I said, in any situation, Christine, and, for us to understand that we have the interest and authority to protect public health. And I feel that we are confident and comfortable enough to do that. And we have discussed here certain, health situations that we understand we have the authority to act on. But this school operations and teacher contracts, because I don't see a threat that you've brought, Kathy or Jeff, with health. We've been monitoring things. We can't, unless we see a situation. We're not protocol and policy authorities for school operations. That authority has been through DESE and the governor to school committees.
I think most times it's when we have like a large number of cases, which is all relative. We haven't had large numbers in Medfield, but comparatively, and letting the chair know that, even today we had 2 different sports teams that are, have impact, even though they're not school teams per se, but they have community impact, and a number of kids are impacted in the schools. So I think that's just helpful to make the committee aware of what's going on in the schools.
So, can I just say something? I'm sorry, Steve.
Go ahead, Melissa.
I think what is probably difficult for people on this call to understand is that the 6 of us are restricted to open meeting laws. So we don't have the opportunity to talk about any of our feelings, about any of how we feel collectively as a group. So in order to have these conversations, we have to do it in front of everybody. And I think there was some misunderstanding perhaps on my part when we met collectively last time with the school committee. The last time we met was in August. At that time, it sounded to me, or what I took from that meeting was, we would reassess after school had resumed in the fashion of the hybrid model, that we would all collaborate again and discuss how this has worked out, what we think has gone right, what we think has gone wrong, put together the data that we've collected, and make a recommendation to the school committee. I think that's where the frustration maybe lies, because that hasn't happened. We keep referring back to that meeting in August. August was 5 months ago, and we have learned so much more, but our voices have not been heard in our expertise as Board of Health members appointed to this role. My question for the board is where do we lie here, and what is our role in jurisdiction? It sounded like Christine said, if we wanted to make a vote to recommend to the school committee, we have that right. Is that the case, even if we're not asked?
Yeah, I mean, I think that is, I mean, it is technically something that we could do. Yeah.
I agree.
So we could like without being asked for our input, we could unilaterally, you know, put together something and vote on it. But it would be a recommendation, of course, you know, but that is something that would be theoretically, that is within our toolkit.
Right.
I would just caution that that would need to be specifically outlined on your agenda.
Right.
That you'd be voting on.
Right.
Sure.
Absolutely.
Procedural. I'm just the procedural girl here.
I understand.
That was my next comment. I think
I just want to know where my lane is here. I want to know if we are allowed to do such a thing, because it seems that I'm hearing the community loud and clear that because we have this collective amount of education behind all of us and credentials and knowledge, it's unfortunate that we're not able to express our views. That's what I'm going to say about it. I'll leave it there. And if we want to add it to the agenda item for the next meeting, I'd be happy to discuss it more.
Right. I think when I was chair, and from my experience, if there is a board member that has an agenda item, just like when the community member sent us a letter about the wood stoves, or I feel, you know, we're obligated to include those agenda items that for either a brief discussion, a further discussion, whether or not we have agree to set aside the time to talk about a certain thing and go and, you know, do some research. That's certainly another step, but I think it's something I'm willing to talk about, anything that any of you bring forward.
Yeah, so I think the, okay, so, okay, so I think we could at least talk at a future meeting about the topic of, I guess what I'm struggling with is whether the agenda item would be to talk about whether we would want to make a unilateral type recommendation as it relates to, you know, what we think about schools in some fashion, or yeah. So would that be the agenda item? Is that what, and you guys want to talk about that?
Yeah, there's a lot of questions in the chat about a recommendation. I'm confused about the recommendation regarding what? The 3 feet versus 6 feet, or I don't, maybe Steve, you can address that. And
Yeah,
maybe
so I mean, so there are some questions at the, there are some questions here about, there's a question that says, Melissa said they were never, oh no, that doesn't have a name with it. There's a question that says, why is this school committee not asking the Board of Health's opinion as it relates to 3 feet versus 6 feet? This is Mike Mattioli again. As it relates to 3 feet versus 6 feet and as it relates to vaccine. So that's a question that I don't think we can answer because it's a question of why the school committee is not asking for our opinion. Then Bobby Rin asks, will the reopening of the school affect the health of the public in general in Medfield? Which is a clever question. I mean, it's a good question. And that is a question that I would say probably the answer to that is clearly yes in some way or another. But that sort of gets to the heart of the matter in some sense. But I think that if we're going to deliberate on that, then we should have that as an agenda item if we want to go down that road. And so I would say that we would put it on the agenda in a two-step process. And not to be overly procedural, but I think we should have an agenda item that says, that discusses whether we would want to make such a recommendation. And then another agenda item that relates to talking about the substance of it. And so if in the first one we decide not to make a recommendation, then we're not talking about the substance of it. That would be my opinion on how to put that on the agenda, which I think is somewhat, I have some discretion over that as the chair. So that's how I would suggest we do that. And I just also wanted it, and I'm seeing nodding heads, so I'm assuming that people are in agreement with that for the next meeting. I also see some more questions that keep coming. So with respect to Chris McHugh Potts has a question about whether if there was a, when children and staff report feeling sick due to fumes related to gym floor resurfacing, and administration becomes angry with the staff who attempt to address the situation, what is the role of the Board of Health? So in that case, I mean, generally speaking, if there was any really type of health related complaint that people in the town wanted to make, they would have to put in a complaint to the Board of Health before we can act on it. So they would, and Christine, you correct me if I'm wrong, but the process would be that someone would have to make, for us to act on something, they'd have to make a complaint to the Board of Health, and then our health agent would take that up and address it. Correct. Right? Okay. It says, I think, Joshua Stefanik, I think Holly made a great point about protection after the first vaccination. Planning school reopening after 2 doses plus 2 weeks does not seem to be the metric schools should be hanging their hat on. It also adds a lot more time to get back. I hope the Board of Health will continue to talk to the school committee about this. So I think we'll take that. I think we've heard that message, and Melissa's kind of acknowledged that we hear that message. And we're trying to do our best in that regard. Jennifer Hearn says, if the Board of Health took a vote on 3 feet being okay for full return, it seems the school committee would move forward to make the full return happen sooner. It seems they need your thumbs up to do this. Oh, shit. Excuse me.
I'm sorry, I couldn't stop you.
Yeah. Sorry.
Sorry, Jennifer.
That's my bad, but I don't pre-read them. So apologies, Jennifer. So anyways, but that point is taken. And I don't know what influence that would have one way or the other. And I don't know, but it's reasonable for you to speculate about that. Mike Mattioli, can I formally request that be put on the agenda for next meeting? I think we've sort of agreed as an approach to doing that if you're referring to the items we just talked about. Joshua Stefanik, thank you. Melissa, for bringing this up. If the school committee has not discussed opening plans with the Board of Health since August, that is not good. And then Lauren Lilgren, thank you for supporting our town with science and common sense. What impact is the hybrid remote learning having on the health of the community, parents, kids, and family? Right. So I think I'm going to close public comment there. So if they keep coming, I think I'm going to close that because I think we have a hard stop on our meeting today. And I want to make sure we schedule or attempt to schedule the next meeting. And I might suggest that we try to do it in a week from now, because I think we still have a lot to work through. Plus this is, so does that sound okay to people? I'm seeing nodding heads. So usually we defer to our clinicians, because Carol and I typically have a lot of flexibility. Is there days next week that are better for Holly and Melissa or Kathy?
Thursdays are good for me, typically. What's Christine's schedule like?
I'm in training all day on Thursday.
Do you want to do, well, Melissa?
I could do Wednesday of next week. Or
I can do Wednesday after 12 o'clock.
Perfect.
I can do that.
Holly?
I can do Wednesday as well, but later in the day tends to work a little bit better. If people could do like a 3 or things settle down a bit for me. I don't know if that's possible. 3 o'clock maybe Wednesday.
Sure. Yeah, it's fine with me. So can we do that? So Wednesday, February 10th at 3 o'clock. And I think in the meantime, we got to work hard on our minutes.
Nancy had to step off, but I'll send her a recording on this. But if everybody could check in with her on what they owe for minutes, I would really like to get them posted as soon as possible.
We haven't received any minutes, Christine, since October.
I think Nancy's trying to compile
Okay.
the list. We got to get caught up though. Okay.
Was that the last agenda item? I'm sorry, I didn't have it in front of me.
I think, honestly, at this point, I think we can move anything else. I want to talk about the 2 associate members that have interest in the board, but why don't we talk about that next week, if that's okay?
Yeah, I'd love to have.
Yep.
It's a great opportunity. It's a great training program. You have 2 really qualified candidates that I think would be very beneficial to you.
Fantastic.
So let's talk about it at the next meeting.
And we'll push off stormwater regulation update until next meeting.
In fact, I'll actually have more information by next week where we stand on that. So,
okay.
I did want to let you know, all of you know, that Mike Clark, who's been doing a lot of your stormwater and your engineering, has had to hand that project off to one of the other people in his office. So I will bring him in soon to introduce him to you, and we can have that discussion. So,
okay.
I'll keep you posted on Mike.
I make a motion to adjourn.
Thank you.
Kathy seconds.
Yes.
Carol?
Yes.
Melissa?
Yes, please.
Holly?
Yes.
Kathy?
Yes.
And Stephen, yes. All right, we're adjourned.